Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about seizure and epilepsy. Epilepsy means seizure disorder, so people with epilepsy have recurring and unpredictable seizures. A seizure is a period where cells in the brain or neurons are synchronously active or active at the same time when they're not supposed to be. Now, when I say neurons are active, I mean that they're firing or sending a message using electrical signals relayed from neuron to neuron. And if you look at the neuron under the microscope, each electrical signals that passes through it really just one ions flowing in and through the protein channels. The way this ion flow is controlled is through neurotransmitters, a type of signaling molecules and receptors. Neurotransmitters bind to the receptors and basically tell the cells to either open up the ion channels and relay the electrical messages called excitatory. Neurotransmitters are close ion channels and stop the electrical messages called inhibitory neurotransmitters. During the seizure, clusters of neurons in the brain become temporarily impaired and start sending out a ton of excitatory signals over and over again. And these are sometimes said to be paroxysmal. These paradoxes, more electrical discharges, are thought to happen due to either too much excitations or too little inhibitions, which are kind of two sides of the same coin, right? The main excitatory neurotransmitters in the brain is glutamate, and NMDA is the primary receptors that responds to glutamate by reopening ion channels that let calcium in. A positive ion that tells us all the send signals. Some patients with epilepsy seem to have fast, long-lasting activations of these receptors. On the flip side, the main inhibitory neurotransmitters in the brain is GABA or GABA, which binds to GABA receptors that tell the cell to inhibit the signals by opening channels that lead in chloride ions, which are negative ions that tell the cell to inhibit the signals. Some patients with epilepsy seem to have genetic mutations in which their GABA receptors are dysfunctional and so they aren't able to inhibit signals. In addition to potentially having a primary genetic positive, these receptors might be affected by all sorts of things like brain tumors, rate injury, or infections. Whether it's decrease in inhibitions or an increase in activations, when groups of neurons start firing simultaneously over and over, it's often unnoticed by others obvious outward signs like jerking, moving, and losing consciousness. But can also be subjective experiences that are only noticed by the persons experiencing it, like fears or strange smells. It all depends on which neurons in the brain are affected. People with epilepsy experience recurring episodes of some forms of seizures. And we can start grouping the seizures by the region of the brain that's affected. When the affected area is limited to one hemisphere or one half of the brain or sometimes even a smaller area like a single lobe, we call it a partial or a focal seizure. These seizures can be subcategorized by whether someone remains conscious during the seizure, which is called simple or partial seizure, or whether someone has impaired consciousness during the seizure, which is called a complex partial seizure. Simple partial seizures typically affect a small area of the brain and could involve the persons experiencing strange sensations like hearing or tasting something, but can also involve jerking movements in specific muscle groups if the neurons controlling those muscles are affected. If the jerking activity starts in a specific muscle group and spread to the surrounding muscle groups as more neurons are affected, it's referred to as the Jacksonian march. Typically, the person is conscious, meaning that they are awake and alert and usually know that something happens and will remember the seizure afterwards. Complex partial seizures, on the other hand, involves losing consciousness completely or having impaired awareness and responsiveness. So they might not remember exactly what happened during the seizure. Now, in contrast to the partial or focal seizures, generalized seizures where both hemispheres of the brains are affected. Sometimes the seizures will start out as a partial seizure and then quickly develop into generalized seizure. And in those situations would be called a secondary generalized seizure. Because partial seizures came before it and was the primary event, just like the partial seizures, there are subcategories of generalized seizures as well. One subtype is atonic seizures, where the muscles of the sudden become stiff and flexed, which can cause the patient to fall off and backwards. On the flip side, though, there can be atonic as well, as where their muscles suddenly relax and become floppy, which can again cause the patient to fall, but this time in the forward. Seizures can also be clonic with the violent muscle contractions, also known as convulsions. Tonic-clonic seizures are the most common generalized seizures, where patients experience a tonic phase where the muscles suddenly tense up, followed by a clonic phase where the muscles rapidly contract.